Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello and welcome. Today's presentation, Breathe Easier with Pulmonary Rehab, is presented by Sherry Harrington. Sherry is a registered respiratory care practitioner at Washington Hospital. She graduated from Chico State University with a bachelor's degree in exercise physiology. She furthered her education at Ohlone College with a degree in respiratory therapy. Without further ado, please welcome Sherry Harrington.
Hi, thank you for joining me this afternoon for Breathe Easier with Pulmonary Rehab. My objectives today is that you understand what pulmonary rehab is, what the pulmonary rehab program might be, and who is a candidate for pulmonary rehab, how pulmonary rehab is performed here at Washington Hospital. So are you having shortness of breath but don't have a pulmonary diagnosis? Maybe you said, oh, I'm short of breath. Let's see what this program is about. How does this have to do with me breathing easier? If you find that you do have shortness of breath, especially with activities, a cough, and or tightness in your chest, you should see your doctor. Pulmonary diseases such as COPD are often diagnosed in later stages. This is because people don't go in when they first get their symptoms. They think I'm getting older, I'm getting out of shape, and they attribute this to their deconditioning. However, they could have a pulmonary illness that they don't know about. A pulmonary function test is a test that the doctor does that will tell what's going on with your lungs and if you have a lung disease. And it's covered by most insurances. So that is why it's important to see your doctor, because this is an easy test that can be done to see if you do have a pulmonary disease. So what is pulmonary rehab? Pulmonary rehab is a series of educational classes and supervised exercise sessions for people with chronic lung disease. Where are pulmonary rehabs administered and who is involved? Pulmonary rehabilitation is an outpatient program and can be based in a hospital or a clinic. And some pulmonary rehab can be done at home or online, especially with COVID pandemic that we've just been through. We're seeing more of the online. The rehab team often includes doctors, nurses, physical therapists, respiratory therapists like myself, exercise specialists, and dietitians. Together, these healthcare professionals create a personal program to meet your needs. So who is a candidate for pulmonary rehab? Pulmonary rehab is for people who have chronic lung conditions, who experience shortness of breath frequently, and are not able to perform their activities of daily living. So some common pulmonary diagnoses that attend pulmonary rehab are COPD, which include chronic bronchitis and emphysema, asthma, pulmonary hypertension, cystic fibrosis, pulmonary fibrosis, interstitial lung diseases, pre- and post-lung transplantation, and other lung surgeries. Before entering a pulmonary rehab program, you need to see your physician. The pulmonary rehab program does require that you have a physician referral. It can be your primary doctor or a pulmonologist. A qualifying respiratory diagnosis is need to be part of our program, and that is done by the pulmonary function test most commonly. Sometimes it is from a CT scan, a chest x-ray, and some other tests that the doctors may do. If you have a COPD diagnosis, you will need a qualifying pulmonary function test to enter the pulmonary rehab program. Tests that the doctor might perform before entering the program would be an exercise stress test, either on a treadmill or a bike, but not always. Also, the pulmonary function test I talked about, maybe a pulse oximetry testing and walking in the doctor's office and checking your oxygen saturation levels, and a 6-minute walk test. How much does this program cost? That's the big question, right? Well, the cost to you depends on your insurance coverage. If you have a Medicare, Medicare does cover pulmonary rehab for COPD if you meet those requirements from the pulmonary function test. So that's why it's important to get that. Medicare may also cover rehabilitation for other lung diseases, but that depends on where you live. And then HMO insurances will require a pre-authorization to enter the program. Medi-Cal also will cover for COPD, and unfortunately not right now for the other lung diagnoses, but it is changing. What to expect in pulmonary rehab? So what is this commitment if you come to pulmonary rehab? Is it like physical therapy? What can you expect? Usually it's a commitment of coming 2 to 3 times a week between 6 to 8 weeks in duration. Sessions are typically 1 to 3 hours long and include education and exercise. Sessions may be group or individual. Some kind of physical testing, such as a 6-minute walk test, may be done before and after the program, and questionnaires in regards to symptoms, psychosocial, nutritional habits are done before and after the program. The goals of pulmonary rehab. So why would you do this? To understand your lung diagnosis, learn how to live better with your chronic lung disease, improve your strength, stamina, endurance, keep out of the hospital and minimize exacerbations, and improve and maintain lung function, reduce symptom severity, and improve your quality of life. Here at Washington Hospital, our pulmonary rehab is located in the Washington West Building, suite number 210. Our phone number is 510-818-7025. You are welcome to call anytime with any questions that you have and talk to any of our staff or talk to me. Most likely, you'll end up talking to me. And our hours of operation are Monday through Thursday, 7 a.m. to 7 p.m. We are closed Fridays, Saturdays, and Sundays. Our program is a one-on-one program, and we are pretty proud of that. There are not very many one-on-one programs in the area, and we are currently in person, one-on-one, following COVID guidelines to keep you safe. Sessions 2 times a week for 2 hours and last for about 6 to 8 weeks. We do exercise specific to individual levels, including stretching, balance, strength training, and aerobic exercise. And we do education, where we cover a variety of topics, and some of these topics are understanding your individual diagnosis. We go over the anatomy and physiology of the lungs and explain in ways that you understand how the doctor has made this diagnosis. And we look at your pulmonary function test and we explain it to you. Sometimes the doctors don't always have time to go over all these results and make it so that you understand what that test is saying and what that test means. Breathing techniques. Pursed lip breathing and diaphragmatic breathing are essential to keeping your symptoms managed. And we teach you how to use these breathing techniques. Energy conservation. Planning, prioritizing, pacing, positioning yourself with your activities of daily living are so important to maintaining what you're doing at home and being able to do it in a way that's comfortable. Medications. We have so many different types of pulmonary medications. There's inhalers and nebulizers and oral medications, and we go over how you use them, why you use them, what kind of side effects might be associated with them, making sure your equipment is working properly. And this is something that's really important because you want to get the best benefit from your medication that you can and know why you're taking that medication. Emotional and social well-being. Stress management, depression, anxiety with a chronic condition can be sometimes overwhelming. And this is really important because it affects our breathing. So we need to really work on stress management, making sure that you don't have depression. And if you can't breathe, it's pretty scary, and anxiety is often associated with that. So we want to make sure that you know that you have a plan and what you can do to minimize that. Preventing infection. This is a huge one right now. Vaccinations, right? We are all getting our vaccinations and doing good hand washing, and we're using our sanitizer, which you can find out about every 2 steps that you take, because it's everywhere, right? Because it's important to use. And know when to call your doctor so that you don't get in trouble and end up calling 911 and end up in the emergency room. Preventing infection and keeping your lungs healthy is the most optimal thing that you can do. Sleep. Sleep seems like a weird one, but a lot of people have sleep apnea. It's very common to have sleep apnea. And for those of you that have it, know that the machines aren't always comfortable. It's a hard thing to get used to using, but it's our job to explain to you why it's very important that you take care of sleep apnea and keep your lungs open and breathing properly through the night so that you get good sleep. Sleep is very important to your overall health and your immune system, and you want to be getting good sleep. The other thing is if you're dropping in your oxygen at night, you're stressing out your heart. So we want to protect your heart as well. So we talk about sleep. Nutrition. Nutrition is very important to our overall health and our lung health and what that looks like. We'll go over that. Airway clearance devices. A lot of times with these lung diseases, you get a chronic cough. Sometimes the cough can have a lot of mucus. If that's the case, then you want to make sure you can clear that mucus out so you can breathe easier. Sometimes it's just how you're coughing, and then we're going to show you how to do that. And sometimes there's some devices we can use that will help you so that you can get that mucus out and have a better day. Other things that we cover, oxygen. Now this is a big one. Typically, unfortunately, you leave the hospital and they send you home and you've got these guys showing up with oxygen and they dump the equipment off at your door and they run. And you don't have any idea how to use this. And it's a very scary thing, and you don't know really what you're supposed to do. So we want to make sure you're comfortable using your oxygen and that it's at the right amount for you, and that you understand the importance of wearing that oxygen and what that can mean. We want you to be safe, and we want you to feel comfortable. It is a life change to have oxygen therapy. But if you don't wear it, you can do more damage. Traveling. We haven't done much of this these days through the COVID pandemic. However, we would like to start doing this, some of us. And how does that look as we proceed in the future and making sure that we stay healthy and safe? And maybe now you've come home with oxygen therapy and you don't know how to travel with it. So this is something that we talk about as well. Quit smoking. It's the number one thing you can do to protect your lungs. We don't require that you quit smoking before you come into the program, but we do like you to have a plan with your physician that you are working on quitting, because this is the most important thing you can do. So what can you do if you've already been through pulmonary rehab? You're like, hey, I know about pulmonary rehab. I did that a couple years ago. Well, there is maintenance programs that are designed to help people, and then there's Better Breathers Clubs or other types of support group that are a really great way to keep connected on what's changed since maybe the last time that you did pulmonary rehab. Here we have a Better Breathers for Life Club at Washington Hospital. Our Better Breathers for Life Club has been around for over 35 years. It is a fabulous group of people. We meet the fourth Wednesday of the month from 12:30 to 2:30, and currently our meetings are taking place via Zoom, which isn't always ideal, but I have seen some new faces for those people that haven't been able to come in person. So we've gathered another group of people that has been really an amazing thing. Everybody is welcome. You can come if you know somebody that's short of breath. You don't have to be the patient yourself. If you have a spouse or a loved one and you want to gather information, you're welcome to join our group. It is education-based, and we go over stuff that we do in pulmonary rehab. We have allied professionals come and speak about topics that are related to your lung health. And then we also have a little fun. Yep, sometimes we do have that as well. So if you are interested, call 510-818-7025 for more information, and I can give you the link so that you can join our meetings anytime. You can join, but it is going to be the fourth Wednesday of the month, and from 12:30 to 2:30, even if we move to in-person. And when we do move to in-person meetings, which will happen someday soon, hopefully, we'll be in Anderson's A and B. That's where it's taken place all the 20 years that I've been here. Social events, hopefully, will maybe in a couple years resume, but we will hopefully be in person and maybe still on Zoom as well. So I hope that you can join us. We love to have new faces. Whoa, I went a little trigger happy, sorry. And then I put some websites here that you can use. There's Live Better with Pulmonary Rehab that talks about pulmonary rehab if you have more questions, but you can always call me, remember, at 510-818-7025. And you'll have a face with who you're talking to. Global Initiative for Chronic Obstructive Lung Disease. This is a really good one if you have COPD. It talks about the stages of COPD. A lot of people don't realize there's stages of COPD, and if you like to really dig in, that's a good one to look at. It's evidence-based and supported by studies. COPD Foundation is another good one, the American Lung Association, Centers for Disease Control and Prevention, Mayo Clinic, and the NIH, the National Institute of Health. The National Institute of Health has some great information about exercise and your lung disease. So that's a really good one to go to. They have some good information. So I want to say, if you want to contact us for Better Breathers for Life Club, we meet the fourth Wednesday of the month from 12:30 to 2:30. We do send out a monthly newsletter. I'd love to get you on a roster so that you can get the information about the meetings. It is in the wellness books that we have our information as well, but you call the number 510-818-7025. Pulmonary rehab, if you think that that is for you, talk to your doctors. Sometimes you have to bring it up to them. What about this pulmonary rehab I've heard about? And again, if you have questions and you need help navigating that, you can call that same number, 510-818-7025, and you will reach, you'll reach us in the pulmonary rehab department, and we'll help you out so that you can get the information that you need. I want to thank you today. I'm going to open it up to questions. We'll leave the information on the board here for you.
Thank you, Sherry. First question. I am 27 years old and I have asthma. Am I too young to ask my doctor for a referral to pulmonary rehab?
That is a great question. You're not too young. Nobody's too young. The real question is how severe your asthma is and how much is it affecting your life. So what you want to do is talk to your doctor, check your pulmonary function status, and the real thing is, are you ending up in the ER constantly? Because then you're not being managed properly. And you want to make sure that your management of asthma is up to par, because it can be very serious and life-threatening. So nobody is too young. But as far as pulmonary rehab goes, your first step was to make sure that your pulmonary function test, where is that functioning? And so I'm going to say, talk to your doctor.
Next question. I had COVID in December. Is there evidence that COVID-19 can cause permanent damage to the lungs? My lungs seem healthy now, but will I need pulmonary rehab in the future?
This is a big concern for people because we know that COVID has affected the lungs in the way that people have needed to oxygen. when maybe they've left from the hospital. People have gone to the hospital, and it's definitely been respiratory related. The effects of this is still unknown. We do know that people have had scarring on CT scans and that they might still have some issues that last after their hospitalization. The question of if it's permanent is still a little bit unknown. And if you have maybe COPD or another lung condition and then got COVID, definitely that's going to also have an effect on what's going on with your lungs. So what you want to do, you might feel okay now, just keep up with your doctor regularly, have them do a pulmonary function test to make sure that your lungs are doing well. If you're still symptomatic, go back. Keep going back.
Okay, our last question. What should I do if I feel my COPD is worsening? At what point should I start pulmonary rehab?
So if your COPD is worsening, you need to go to your doctor. There needs to be a change in the management of your COPD. You need to look at what the cause of that is. And we do know that COPD is a progressive disease, and maybe it is time for you to do pulmonary rehab. So you should, at the minimum, have a pulmonary function test and talk to your doctor, have that conversation that maybe it's time that I go to pulmonary rehab.
This concludes our program. Thank you, Sherry, for your expertise, and thank you to our viewers for tuning in. The entire broadcast of today's event will be available on our Facebook page and YouTube.